Well, hello and welcome everyone to the CTRC's Telehealth Summer Summit webinar series. My name is Kathy Chorba and I am the Executive Director for the California Telehealth Resource Center. It's my pleasure to introduce a longtime friend and colleague, Ms. Amanda Harris from Mayor's Memorial Hospital District. Amanda has agreed to join us today to speak about telemedicine in a rural school district. So before we get started, I'd like to remind you of a few logistics. Amanda, you can forward the slide. Thanks. First of all, as you all know, because you're Zoom experts by now, is to make sure you use the Q&A functions on Zoom for questions and comments for the speakers, and you can use the chat box to talk about logistics such as I can't hear you or where are the slides going to be posted. So speaking of where are the slides going to be posted, is this session will be recorded, and of course your attendance is consent to be recorded. And the recording and the presentation slides, as well as the Q&A section, will be made available on our website by this Friday. So thank you very much for being here with us. We're so excited to bring Amanda on board. And Amanda, if you can take it away from here. Thank you.
Thanks, Kathy, and thank you everyone for coming to hear a little bit about our counseling program we have going up here. I apologize I don't have video, like I mentioned to the ladies when we were getting started. We had it, I used it yesterday, but you know, that's the breaks, I guess. So I wanted to talk to you today about our counseling program. I'll explain at the end why we call it Take 4, but we're doing some telemedicine in a rural school district up here in Fall River Mills. I am the telemedicine coordinator here, and we'll just go ahead and get started. So where are we? Mayor's Memorial is a critical access hospital located in Fall River Mills. We're about 17 miles east of Bernie. If you've ever heard of Bernie Falls up here, that's kind of the closest real landmark. And our nearest city is Redding, California, which is about 70 miles away. It's about an hour-and-a-half drive down a windy road, so it's a ways. Our local school district is made up of 6 school sites. 3 in Fall River and 3 in Bernie, which I mentioned was about 17 miles away. So there's, 2 elementary schools, 2 high schools, and 2 community day schools were formerly called continuation schools. And I should note that this is an outdated picture of our hospital. It was the easiest one to access, but we actually have a beautiful new ER imaging lab area opening up, I think next week. It's very pretty. If you're at all curious, you should check it out. And that's just a picture of Fall River Elementary. That's where my own kids go. And actually, funny story, I went there when I was a kid as well. My husband and I both went there actually, so small town. So how does Mayor's use telemedicine here in Fall River? Well, we have a couple different ways. We do outpatient telemedicine services with our outpatients in our community, as well as our skilled nursing residents. We have skilled nursing facilities both in Fall River and in the Bernie area at our annex. And the Bernie annex actually has a memory care ward as well. So we provide endocrinology services, infectious disease, which is primarily hepatitis C treatment, but we do a couple other random appointments as well. Neurology, nutrition, and diabetic education, which works really closely with that endocrinology specialty for our diabetic patients. Psychiatry, very heavy in the skilled nursing area, and rheumatology as well. And then for our ER and acute services, we have contracts with UC Davis for peds critical care and for neurology as well. And we also do e-consult and different things like that as well. So what services did the school have, the school district, before this program? They had one school psychologist for the entire district. And he was primarily involved in like the IEP evaluations, the individual education plan evaluations, but he was serving all 6 locations. It's approximately 1,200 students, so it's kind of a lot for him. They do have behavior paraprofessionals at each site. Most of them are part-time, but there is one that's full-time. And those behavior paraprofessionals have some additional training, seminars and things like that on behavior and mental health and how they can help those students, but not a whole lot of training. And then there were occasional visits from the local clinic system that is outside of Mayor's, and they were doing that to help out the school district. They were unbilled, and they ended at the end of the 2018-2019 school year. So why is mental health counseling so needed in schools? I think that's you know, in this day and age, people really understand why we need mental health counseling. But just to be clear, this is a lovely site that our grant administrator, Sheba, put together for me. But basically, there are a lot of different statistics about students needing services, and school is the best place to access those students. So on average, 15% of young children have parent-reported developmental disorder or diagnosis. Of children aged 9 to 17 in California, 21% of them have a diagnosable mental or addictive disorder that causes at least some impairment. Children with mental health problems are more likely than their peers to experience a range of different difficulties, including absenteeism, which is really important in our school district. I mean, I think in every school district, trying to limit absenteeism, but also their grades and test scores can be impacted as well. And then, you know, mental health outcomes and education outcomes are intertwined very closely, and really both affect the development of children. And a lot of our information, too, is gathered from the California Healthy Kids Survey. I don't know, you know, for those of us attending that are from California, I highly recommend you check it out. They have a lot of great information about the different school districts and things like that. It was alarming to me, you know, not this year's, but the last Healthy Kids Survey. It really stuck out to me that of the 10th graders in our school district that were surveyed, like 19% of them had considered suicide. And that's really a showstopper for me, in that, you know, services are needed in our area. So it actually came about in a very small town kind of way. I'm actually a part of my own schools, my own kids' schools site council. It came up during site council that those occasional services provided by the local clinic were going to have to come to an end, just due to you know, not having enough time and providers available to do it. And I asked, you know, how we were going to supplement that service that was being ended, and they did not have a plan for that or a budget. You know, school budgets are tight, and they didn't have a plan for that. And so, of course, being a telemedicine coordinator, I was like, well, what about telemedicine? And they didn't have a budget for it or any plans for it. And so I went to my CEO, Louis Ward, and he had just that day gotten an email from Sheba, again, our grant writer here at Mayor's, regarding a small healthcare provider quality improvement program with HRSA. So we applied under the framework that we would be improving the local clinic system by teaching them how to provide services in the school district, which is something they were not doing before, via telemedicine. So we identified a site coordinator at each of the 6 schools, basically a little mini telemed coordinator at each site. So we trained them about telemedicine, about HIPAA, about successful presentation techniques for telemedicine, and how to effectively run a telemedicine appointment. We deployed iPads, cases, stands for the iPads, and headphones to each as well. So we started out the program with the local clinic because we are training them up in order to learn more about doing telemedicine at the school districts. We gave them 1 school's worth of students to see. So their LCSW at their clinic provides counseling hours to 1 of the schools in our 6 sites. And then the other 5 schools were served by psychologists that we contracted with Telemed to you for, who you know, does telemedicine on the daily. So she's old hat at that. So she's great. So this is kind of what it looks like. We have Dr. Masters with Telemed TU serving Fall River Elementary, Bernie Elementary School, Soldier Mountain High School, Bernie Community Day School, and students at Fall River High School. And then we have Jill Reed with Mountain Valley Health Centers serving Bernie High School. And then there you can see that overlap in the middle there with Fall River High School. So there's 1 student at Fall River High School who was seeing Jill Reed before this program started. And as the school year went on, the student inquired if she could see Jill via telemedicine from school. So she's our kind of one-off that at Fall River High School sees Jill. So the site coordinator at Fall River High School kind of has to, you know, juggle between providers, but we did get that student's needs met. So as you can see, it kind of gives Jill a chance to kind of get used to the format and the modality of telemedicine before we overwhelm her with the entire district's worth of students that are needing to be seen. So what about consent, the really fun part? So the next couple of slides were made by our Director of Quality, Jack Hathaway. for our HRSA breakout back in March, but they were really helpful, so I thought I'd include them. So in California, a minor 12 years of age or older can consent for their own mental health treatment or counseling if they're deemed mature enough to do so, and to participate appropriately. So basically, if a 12-year-old came to one of our site coordinators at the school and requested services, then we could technically put them in an appointment with Dr. Masters or Jill to be evaluated for maturity and then have their appointment. So this is the law that kind of covers that. This is a little bit more about that. The mental health treatment or counseling services means the provision of services on an outpatient basis by any of the following. And we kind of fall under number 5 there, a professional person, because Dr. Masters is a psychologist and Jill is a social worker. So that's kind of where those, and it's really important to understand the law because, you know, it's really easy in a hospital setting to be like, you know, this is the law. You get to get seen. If you want this, you know, if you want these services, you get them. But in school districts, it gets a little more muddy. So this is the muddiness that I was just talking about. Basically, when we first explained the law to the school district, we definitely had some rub. You can see our little explosion there on the left that they kind of felt like, you know, how can we apply this to us? You know, what will the parents say about that? And I completely understand that. As a parent, you know, if my 12 or 13-year-old had requested counseling services, I would want to know about it. I would want to know what's going on, like how can I help? How can I be involved? But the law really wasn't written for those parents that are wanting to be involved and, you know, want to be a part of it. It was really written for students that are living with someone besides their guardian. So some of our students are homeless. Some of our students are living with their mom's boyfriend because their mom is incarcerated, or, you know, there's a lot of different scenarios. They're living with an aunt that has never been totally awarded guardianship that's local, so they can still finish out their high school, you know, so there's a lot of different scenarios where it's important for a student to be able to consent for their own services. And some would argue that those students that need to be able to consent for their own services are the ones that need them the most. So it's an important law. It's a difficult law to tiptoe, but it is important. And we had a lot of rub last fall trying to get the consents out. You know, we wanted to have a unified rollout where we just sent the consents home with the back to school packet, but the superintendent was a little bit nervous about that. And so it was sort of handled on a case-by-case basis. So obviously the students that are 12 and under, the parents were contacted and the consent form was signed, and we moved forward. That's not a problem. For the students that are 12 and older, a lot of the schools already had existing relationships with the parents of those students, and the parents were aware that there were issues at school, and so we would kind of carefully coach each student and their family through the consent process for this first year. Now that the program's been going for a number of months, we plan on and have agreed with the superintendent to have the consent forms go home with the back-to-school registration packets so that they all come back. Each site coordinator will just have like a binder full of all the consents so that when a new student comes and wants services, we already have that consent established and done. So hopefully make that process a little smoother in the future. So this is kind of what the workflow looks like for a student over 12, like we were just discussing. So a student would be referred to the site coordinator, either by staff, their parent, or themselves. The site coordinator would add the student to the next scheduled block of time. So I, as the program director, assign blocks of time with the counselors to each site, and then the site coordinator fills those blocks with the students that need to be seen. The student would meet with the counselor to be evaluated for maturity. Once the student is evaluated and deemed able to consent, the appointment would proceed. The appointment occurs, and then there is a post-appointment survey that we give to the student to fill out right at the end there. And then the follow-up is confirmed by the site coordinator and myself as well, just to make sure that that follow-up happens. And then we've never had this happen, but if a student is deemed unable to consent, then they would follow the under 12 guideline to follow. So for our students under 12, the student would be referred to the site coordinator by staff, parent, or themselves. The site coordinator would verify that the student consents on file. Now, if the student themselves was, say, 11, and they asked to see the counselor, the parent would be notified first, just so that everybody's kept in the loop for the student under 12. The site coordinator verifies that the consent is already completed. The site coordinator adds the student to the next scheduled block. The appointment occurs. The post-appointment survey is done, and then follow-up is confirmed by the site coordinator and the program director. And it's confirmed by me in that all the chart notes from all the counseling sessions are sent to me and are kept in a separate repository here at Mayor's, so that way, if the students are ever referred out to a psychiatrist or to an in-person counselor or psychologist, the student or student's family, whichever is appropriate depending on age, can request those chart notes from me doing a med records release through the hospital. So that kind of makes everybody a little bit more comfortable in that, the student's business isn't having to be stored at the district somewhere, it's stored here safely and securely, and it gives one point of contact for all the chart notes to go to. So that made everything a little bit smoother. So how was year one? So we started services back on September 30th, 2019, and our last day of service was March 12th. School was shut down, obviously, due to COVID after that. At first, we thought it was only going to be like a couple weeks off, and then as the weeks went on, we noticed that it was going to be a lot longer than that. So we, starting May 1st, we resumed services here at Mayor's. We kind of just started using my, because we do the outpatient telemedicine here, we use the outpatient telemedicine room, and I reached out to all the students that were using the services to see if they wanted to continue them. During the school year, when school was taking place, we had 311 consults at the school sites, which I think for a first year, well, it wasn't even a full year, but 5 months or so, and Christmas break was in there and everything, I think is not too bad. And then when COVID happened and we started services here at the hospital, we've done 52 consults. That's actually 60 now. We did 8 last Friday, so it's 60 consults so far. And the part that I really liked is that it's truly showing the flexibility of telemedicine, because some of our students have the equipment and internet connection at home that they can actually take part and see Dr. Masters from their homes, and they've chosen to do so. And it's awesome because she will see students here, click off at 11 o'clock, connect to another student from their home, come back at noon, connect here again. It's just really amazing and just the epitome of flexibility, which is really nice. So I'm very happy about that. So overall in year one, 59 individual students were seen. So it's become abundantly apparent that services are way easier to attend during the school year. And that's shown even after COVID, and we still offer the services here from Mayor's. A lot of the students that were using the service while they were in school, their parents couldn't drive them to appointments up here. Parents couldn't miss work to get their students to appointments up here. It's not easy always. So definitely goes to show, like, having the service in the school where students can be, as accessible as possible really is the best way for them to get the services that they need. And also it's minimal time out of class. I mean, it's usually, 30 minutes max. Sometimes the initial appointments can take a little longer, especially with that evaluation for maturity and everything. But for the most part, they're not missing a whole lot of class. And the site coordinators are very conscious to kind of pick which classes the students are being pulled out of and stuff. So it's been going really well. So this is just a peek at that post-appointment survey that I mentioned a couple slides ago. The one on the left is the one that we get to the elementary school kids. As you can see, the little very unhappy face to the very happy face, asking how they felt before and after their appointment. Do you feel like the counselor listened to you? Kind of a qualitative, do you feel like your, feelings were heard? And then are you looking forward to seeing them again? The high school survey is just a little more in-depth, but the same idea. Do you feel like you were listened to? Are you looking forward to talking to them again? So important to do that, see that, it's making some kind of difference, and great for, keeping track of the program, making sure it's useful. So this is kind of just a snapshot of that high school post-appointment survey questions about their feelings. So as you can see on the left, we have the how are you feeling before you came in to talk today. You can see there's some higher levels of the depressed, anxious, stressed side, still some calm and neutral, a little bit of frustrated there in the middle. But as you look on the right, the post-appointment, how are you feeling now? The graph is definitely skewed more towards the positive end of the spectrum, the calm and neutral. It looks as though the loss has gone down, the frustrated has gone down, and it's important to pay attention to in this to the vertical axis. I realize the bars are about the same height, but if you look at the vertical axis, the numbers are vastly different. And the students are allowed to check as many boxes as they'd like. So, they could still check those anxious, stressed, angry, whatever they wanted, but they, it did bring them some resolution just after one appointment. So that's important to see that, know that it's worth their while. So what are we looking at for year 2? Well, our, it could change at any time, but as of this moment, our school district is currently planning on returning to school with COVID precautions in place on August 26th of 2020. I'd like to give the schools and the site coordinators a week and a half or so to kind of get used to their, new COVID way of life at the school, and so we're not going to start counseling services until probably that Tuesday after Labor Day. I think it's the 8th. We are anticipating quite a large turnout for counseling services when we resume, partially because, for a lot of students over the summer, services didn't end. So we already have that baseline number of students that want to be seen. But then also a lot of students that were being seen last year wanted to wait until this year to, school started again to see the counselor again. So all those students will be coming back. Plus, a lot of students will be new to counseling and needing it coming back after COVID. Sad to say, a lot of students have been stuck at home in negative situations for months on end, and will definitely need someone to talk to about that, some of their anxiety and stress and everything else. And also, I know that some of the high school students have a lot of anxiety about coming back to school because there was kind of a no harm to grading situation happening at the end of last year, and so a lot of students at the high school did not participate actively in class as much as they would have, and I know a lot of students are, because of that, feeling kind of anxious about coming back to school. So I think we'll definitely have an uptick in service right away, I would imagine. But also, before school returns, we've offered for Dr. Masters from Telemedicine to provide kind of a webinar and a question and answer time for staff and teachers to prepare themselves to better welcome the students back into the school environment, because these students have been through a lot the last couple months. And also, the teachers, I think, are at an all-time stress right now with trying to figure out how to safely return to the school environment with COVID. So the superintendent was very interested in that. We're working on a date right now, but there's a lot of things the school is working on right now, so we're trying to get that squeezed in there. We've always welcomed families to join the students, and frankly, over the summer when parents had to bring the students to their appointments at Mayor's Memorial, the parents have been greatly involved whenever it was appropriate. Some of the older students, their parents did not, weren't there, but for the younger ones, Dr. Masters and Joe love when the parents are able to take part in the appointments, and that's been a really good thing. So we're going to keep that up whenever we can. And then last week, actually, the district psychologist inquired about if we were able to offer services to staff as well, because, like I said, this is a stressful time for teachers. Things are changing constantly, and so we're trying to figure out how that fits into the scope of our grant, and talking to HRSA about that and see if that's something that we can expand that to include, like use them as another population of patients to serve. So we're going to see if we can do that. And then, of course, we're probably going to keep the services for independent study and distance learning students available to attend by home if that's something that they have the technology and internet connection to do, because it is easy to just, step back and forth in the appointments. So definitely be open to that if needed. So finally, I just wanted to close with our little logo again. I love so much. One of our high school students actually created it at Fallbrook High School, and we had a little art department competition, and that was the one that was chosen. But it's called Take 4 Counseling because it takes really four different entities to create this program and to really keep it running well. And it's been going really well. I'm very proud of it, but that's why it's called that. So I think that pretty much wraps it up for me. If anybody has any questions.
Thank you, Amanda. This is terrific information. I really appreciate you taking time out of your day to present this to us. You know what I really enjoyed? Well, amongst all the rest of the presentation, but I really appreciate you sharing your best practices for consent and also for workflow. I found that to be very, very, very helpful. So for those of you who want to, if you can flip to the next slide, Amanda, that would be terrific. So for those of you who would like to take a peek at the slides, we will have this presentation as well as the slides available on our website, probably by the end of this week. And I wanted to also remind you that coming up next are some very amazing presentations as well. We've got a grant writing overview for tips, tricks, and what's available. Just also reminding you, I'll back up just for a second, is there will be time for Q&A. At the end of this session. I'm giving you just a little bit of time to type your Q&A into the Q&A functions on the Zoom feature at the bottom of your screen there. So any questions that you have for Amanda, go ahead and type them in while I'm telling you about the upcoming sessions that are coming up the rest of this month and early next month. So again, upcoming is Grant Writing Overview, Tips, Tricks, and What's Available, put on by Dina Satterwhite from Learn, Design, Apply, Inc. After Dana, we'll be navigating the telehealth landscape, which we'll be talking about pressing legal issues in telehealth, presented by Hooper, Lundy, and Bookman. And then that will be followed by our virtual technology showcase, which should be interesting, providing that one over video. And that will be presented by the Telehealth Technology Assessment Center, TTAC. Up next after TTAC will be Bedside to Website, Optimizing the Telehealth Experience, put on by PWN Health. If you missed our previous event, the Building Blocks to Telehealth Success and How to Structure a Compliant Telehealth Offering, that recording as well as the slides and the Q&A section are now available on our website. So if you haven't already, please sign up for our future events. Go in and check out the events that we've had in the past. And I do believe we have one question already for Ms. Amanda. And the question is from Karma Scott. Did the school not have their own in-house psychologist? And how do you work with the provider at the school?
That's a great question. And I know it sounds crazy that we wouldn't have our own in-house psychologist. So as I mentioned, we do have one psychologist. He is for the entire district, so all 6 schools. So he is spread rather thin, and also his time is greatly monopolized by IEP evaluations and also those urgent need students. As sad to say, there are students every day that have pressing, issues that he has to attend on site, and so a lot of times those general counseling and well-being of students, counseling appointments get kind of pushed to the side. And so, yes, there is one district-wide psychologist, but again, he's a busy guy. So.
All right, thank you. And I see a comment from Alberto Kiwi saying, thank you very much for your presentation. And Rebecca, do you see anything else in the Q&A and the chat section?
Yes, I do. So Alberto asked, are visits done on paper or via an EHR?
So that's a great question. So what we do is, this might be a little more detailed, but I'm just going to tell you guys anyway. So for that first appointment, we have, the site coordinator builds the appointments in the counseling block of time that I've given them at each site. If it's the student's first appointment, they'll also send in the consent form with it's like a notice of privacy practices, but it includes all 4, both counselors' notice of privacy practices on the back signed by them, submitted the first time. And we have a very basic bare bones demographics page because there's no insurance information needed right now. It's literally, the student's name, sex, date of birth, and any, precursor notes on why the appointment's taking place. It can give the counselors kind of some input. So we fax that all in. That's how it's built on the provider's EMR side. So like Dr. Masters has EMR on Telemed2U side, and they build it on their side. Jill has an EMR on the Mountain Valley Health Center side, and they build it for her on her side. Both providers, after an appointment, will generate a chart note. The chart notes are emailed, well, they're in a portal kind of situation for me now, but they're sent securely to me. And then, yes, they're like PDFs that I store in a repository here at Mayor's that's separate from our regular medical records because they are mental health records and part of a grant project. So we kind of keep them separately, sorted by the students. So yeah, I mean, it's like it is paper if we printed it all out. I don't have a separate EMR just for the school district and this program.
Thanks, Amanda. And then you also have a comment from Dr. Marson just saying that you did a great job and congratulations on your efforts and leadership with the program. And I actually have a quick question. So if anybody else, while I'm asking my question, has questions, please feel free to put them in the Q&A. I'm just wondering, Amanda, especially since it was kind of a grassroots project that you helped to start, were there any challenges to getting started like this?
It's a great question, and yeah, there were a lot of challenges. Obviously, the consent, I kind of mentioned that a little bit in depth, but the consent was a huge one for us. Also, moving into year 2, we're trying to think about sustainability after the grant period is over. I'm looking at things like, for us up in Shasta County, Partnership Health Plan is the managed Medi-Cal for our area. So what is, and this is, I'm really diving into the whole telemed coordinator kind of side, so this might be a little too in depth, but what's recognized as an originating site for Partnership Health Plan. We have a ton of partnership patients and students in our area. How can we make the school an originating site so that the school can offset some of the costs of counseling to make this long-term financially possible? So sustainability is our current challenge now that we've kind of gotten consent under control. But no, I think there was anticipation on the school side of a lot more blowback from parents, but really parents have been very open to it so far. And, mostly, obviously the younger students' parents are open to it because they're involved. But some of the older students' parents, I think there was a lot of fear about, I want to know what's going on with my kid and I want to know, but once you explain the law and stuff, most people are understanding. And I think that there's, it's definitely needed. We've had to do our fair share of, Dr. Masters has had to do her fair share of CPS reports and other issues have arisen that have needed to be addressed. So I'm glad the program is there. It's definitely, needed and it makes the challenges worth it.
And just because I'm having so much fun picking on you, I have another question.
Feel free.
So in the schools, and this may be a different answer for each campus that you're talking about, but in the schools, do you have a school-based clinic there? And if not, where were these visits being done?
This is a wonderful question. So we do not have school-based health centers right now. It's something that mayors as a entity is definitely looking forward to. We're building a primary care clinic right now in Bernie, attached to that annex that I mentioned previously. And definitely school-based health centers are something that we would love to lean towards. Now, what that looks like in our school district is yet to be addressed. And obviously, once we have that clinic established, our primary care clinic, and can look into that, it will definitely be more looked into. We're all about working with the local school district, so it's definitely something we want, but we do not have it yet. So basically, at each site, it's different. But I mentioned those behavioral paraprofessionals. Almost all the schools have a dedicated room for those behavior paraprofessionals, so that if students are having an emotional issue or a behavior issue, the paraprofessional can pull the student out of class to go to that removed room. So because a lot of the paras at the schools are also my site coordinators, then they use their same room for the counseling as well. And that's the case in most of the sites. Some of the schools, especially the community day schools, are so small that they actually use just like an office or a tiny, in-between room. But no, we do not have school-based health clinics yet, and so we kind of had to establish a site at each school.
One last question, and then I'll stop asking you questions. So I know that you, I know that you mentioned having Partnership Health Plan for your Medi-Cal patients. Are you guys seeing everybody regardless of insurance, or are you seeing a specific population?
So right now it's grant funded, so we are seeing any and everyone, and it's amazing and it's awesome and it's needed. So we're hoping that the data and the surveys can continue to demonstrate a need to both the school district and to payers, so that we can, really work on that sustainability. A little tough because COVID ate into our first year of all our data and surveys. We have these, we survey the elementary school teachers twice a year, once in the fall and once in the spring. The high school students we survey twice a year, once in the fall, once in the spring. We have surveys for the principals, surveys for the site coordinators, and we normally, like I said, do them twice a year. But with COVID and the schools shutting down, we had a drastic reduction in survey completion for like the high school students and stuff like that, because they just weren't logged in anymore, So hopefully we can get more of a school year out of next year to really get all that data and make a worthy case.
Wonderful. So we have not had any more questions come in. I think people have just been enjoying listening to me pick on you and ask you questions. So unless anybody is typing in super fast, I think that we are probably going to let Amanda go and let you all go. And we thank you so much for joining in on us. And Amanda, this was amazing. Thank you very much for presenting for us. And the slides will be up by Friday, everybody, along with the recording.
Thank you for having me.
Thank you. Have a great day.